Making your way through an endless stream. Silence cuts reality by the seams. Only for a moment, moments always seem to fade away. Searching for the picture, always out of reach. Holding on to freedom, yours to keep. Only for a moment, moments always seem to fade away.
Hello, everyone. I'm Greg Staley of Diverge Media. Thank you for joining the Sunday show. Just going to be me today, and we have a few changes. So I've been working on things for the show. We're going to lay that out for you in just a moment. But basically, we're going to be segmenting the show into 5 main topics from here on out. And it's going to look a little something like this every Sunday. So as we come through, you're going to see our topics here. We're going to go through. It's not going to be perfect on the 5 segments here, but basically as we go through, you're going to see the marker move, and you kind of get an idea where we're at in the show. So starting out, we're going to be doing data the Canadian media has been ignoring. So I've compiled some data in an article of ours that kind of puts everything in perspective. It is important to look at. So we'll go into a few things before we get into that, but let's get into a Toronto Sun article here. So this was released. Let's get it out. Craig, thousands of Canadians have died awaiting surgeries, July 8th, 2021. So earlier this year, we asked 30 health regions and hospitals for data on patients passing away while awaiting for surgery, procedures, diagnostic scans, and appointments with specialists. From April 1st, 2019 to December 31st, 2020, secondstreet.org obtained government data showing over 10,000 patient deaths. So 10,000 patient deaths while they were waiting for surgery, procedures like diagnostic scans, appointments with specialists. Now, some of them were likely going to pass away anyways, but again, that's a concern. 10,000 1 year on waiting lists to get treatment. And then we've exasperated this problem, so that's why we bring that up. And baffles me that it's really not talked about, but that's been out there for a little bit now, and we're seeing it out there. Thank you. Appreciate that. Thanks for joining us, and let's get into our show. Data the Canadian media ignores. Oh, we got to multitask here. My goodness. All right, so put this together from our World in Data, which is run by Oxford, University of Oxford, and they do a good job of compiling data. And so below is a chart. We did cases per million people. So I'm not concerned really with the number of cases. I want to know per million because that puts it on, in my opinion, a balanced comparison to compare on. So when we go cases per million, we see that Sweden, this is the United Kingdom, Sweden, and Canada. And Sweden is below the United Kingdom on the most recent data set. And but if you look at what I have found more interesting is Sweden didn't lock down, UK didn't lock down initially, Canada did. But we see that pretty well. It's similar spikes and things like that. Then we continue down. Number of COVID patients in hospital per million people. Now when we can get into this data, this is where it can be a little bit eye-opening. So number of COVID-19 patients in hospital per million. France, the highest. United States, United Kingdom, this is the most recent data. Doesn't mean they always were. Italy, then Canada. Sweden below Canada for number of patients in hospital, of COVID-19 patients in hospital per million. Okay? Didn't lock down. we want to prevent the hospitals from being overwhelmed. And they have less, currently have less COVID-19 patients in hospital per million. And I'm going to pull this one up. Maybe we can look at this a little bit further because it's tough to see with all the additional countries in here. So we're going to pull a bunch of these off. Oh, we don't have Sweden in here. Let's just go Canada and Sweden. Pull up the data. But here oh, goodness gracious. I haven't actually pulled up this data myself, but let's just talk about this for a second. Okay, so data the Canadian media ignores. This is our rolled in data. University of Oxford compiles the website here. I shouldn't laugh. But anyways, one country didn't lock down, and one country has elements and provinces still experiencing lockdowns and restrictions without an end to sight to some of those. So anyways, here we are. Sweden, less hospitalized patients. Actually looks like pretty well for the entire pandemic. But that's number of patients in hospital, so that's inaccurate. We want the per million. That's why I was going to say that's not what we wanted. How many people are in intensive care ICU at any given time? But you can see this is a great source you can come into. There's a lot of different data sets in here. That's not what I wanted for hospitalizations. Here we go. Hospitalizations per million. There it is. Just for population. Sorry, everyone. You can see how it is a headache to comb through this data, though. And let's get Sweden back up. There's our comparison. So now, number of COVID-19 patients in hospital per million. So Sweden has, on average, done worse. So that is that is what I expected to see. So, but what I wanted to show you is we know our systems here haven't been overwhelmed. And it's been pretty well the same in Sweden. And so, but if you look at, I mean, this is pretty identical spikes. And yes, we have less patients in hospital per million, but we also don't know the direct comparison. What's the population density breakdown? Where was the predominant amount of outbreaks in Sweden versus Canada, et cetera? So it's an apples to oranges comparison still, but it's an important one to look at. So you can see you're following those ways, and it's pretty well parallel. Back to the article here, continuing in the data. Now we get into number of COVID-19 patients in hospital per million. United Kingdom on top, currently Canada, Sweden, then Israel. So again, they didn't lock down, and they're doing better right now currently in a lot of these metrics. And a lot of it, when they may have had higher numbers on hospitalizations in ICU, but it's pretty well run parallel with the spikes and ebbs and flows of Canada and other countries. And number of COVID-19 patients per million, there's Canada and Sweden side by side. So Sweden initially, big spike. You could say that was the price they paid. Then they actually below from about maybe May, June of 2020, and then a little bit above again, but they pretty much run parallel, and they're doing better currently. So we locked down, we've caused a lot of harm. We know about the harm that lockdowns have caused, but here's one I think gets interesting. Excess mortality during COVID-19, all ages. Now, this is a side-by-side comparison of Sweden and Canada, and you can just see it. All right, so Canada is actually higher in initial, and then again, you see that spike where Sweden didn't lock down, but all through, or about August 2020, all through to about November, they were below us in all-cause mortality. Slight spike above again. Again, they're not restricting movement, so you're going to see that. And then it drops again below, and then we don't have Canadian data, but it looks like they're either on par or below where Canada's currently at. And then for those saying we should have locked down, like Australia, let's pull in the all-cause mortality. There's Australia versus Sweden. Again, Australia below at some points, above at some points. You got those big spikes. I guarantee you are medical professionals here in Canada say that's not worth it. But again, while we look at the comparison from February of 2021, they're much below where the all-cause mortality is at Australia, who's been very draconian in their approach. Continuing on, one more. Well, what about New Zealand? Well, they've been, locked down. Not to mention it's apples oranges comparison again. But here we are again. So again, initial spike, we see that. New Zealand below for much of it, and then on par. But then again, where are we at now? We have Sweden from, this looks like a very small sample size from here, but it's February to June of 2021. That's where we are to July, actually. This is where this is. So they're below all-cause mortality for quite a large chunk of 2021. So that's the Canadian data the media ignores. That's just getting into it. Lockdowns don't work. That's right. Lancet, August of 2020, I touched on this in my Rebel interview with Tamara Ugolini. They reported that full lockdowns, rapid border closures did not result in reduced mortality. But we're still trying it here in Canada, or at least in Ontario where the science is different. So now, continuing on. Where's my slider here? Bam. Trudeau photo op. Trudeau, if you haven't seen the picture, we're going to pull it up for you now. I mean, this is nothing new from our Prime Minister, but here he is. This is our correspondent, Paul, shared it. 51 Boyle advisories on reserves, and Jester Justin is doing a photo op on children's graves. I really hope people see him for who he really is. So, again, said he was going to solve the water boil advisories. There's been little movement on that. And so you take a picture like this, and you deserve the criticisms coming with you. And it shouldn't be a shock to anyone who follows politics and knows about our Prime Minister. What do we talk? 4 ethics violations now, multiple times in blackface. She experienced it differently. Are we getting the hypocrisy yet on this guy? Very clearly, there's an issue on the Indigenous issue that needs to be resolved. But we can't ignore the past, but you certainly can't ignore what's happening. We have churches burning down like crazy and a Prime Minister whose secondhand man said it's understandable. So yes, I'm just letting everybody know I like to have my facts straight. So before I make many more comments on any of what's been going on the Indigenous Files Affair, I'm looking into the Reconciliation and Truth Commission, and that's there's a bunch of documents attached to that, but I'm trying to better understand what's already been said on the record. My understanding is a lot of what's coming out isn't new information, but it seems that there's been a political slant and a narrative being taken that is gaslighting and polarizing the public rather than uniting. And that is problematic when we're talking about overcoming and uniting a Canadian people. Back into the comments here. What do we got? Yes. Oh, where we got? There we go. Let's get some comments in here. All restrictions lifted today in Saskatchewan. And, you know, I wish I had moved. Glenn, I wish I could afford the move. Truck expenses for moving for everyone out there. If you're looking at moving a long way, they've gotten astronomical. Not only are gas prices astronomical now, but you also have to contend with, I think it's like a 200-kilometer limit. And then they charge you 80 cents, 90 cents per kilometer after that. So it would have cost me $4,000 plus gas just to get a truck out to Saskatchewan, plus my moving, plus the cost to get into a place and all the additional things that come with it, hotel stays. So it's insane how expensive that's gotten. But continuing on here, let's get into lockdown, Ontario lockdown stupidity. All right, sorry everyone. And bam. All right, off without a hitch. It's working. It's working. So if you haven't heard about the step 3 into reopening, what do they call it? The roadmap to reopening plan. Well, here it is briefly. Let's get some of these exits. Sorry, everyone. Here it is. Ontario moves to step 3 of the roadmap. This is our article. Don't get too excited, I say. Today, the Premier of Ontario announced that Ontario would be moving into stage 3 of the roadmap to reopen on July 16th. As Alberta, Saskatchewan, BC are gone with restrictions and mask mandates. This is the experience in Ontario. What do they say? The government's release says that we will remain in step 3 of this roadmap for at least 21 days and until 80% of the eligible population aged 12 and over has received 1 dose of the vaccine, and 75% have received their second, with no public health unit having less than 70% of their eligible population aged 12 over and fully vaccinated. So if there's one single health unit in the entire province that has 69.999999% and not a single person more will get a vaccine, you will never get your freedoms back. The goalpost, in essence, has shifted once again, Ontario. And how do we lose the face mask according to the government? Well, here it is. For the face mask mandate to disappear in Ontario, 80% of eligible Ontarians have age 12 plus must receive their first dose, and at least 75% must receive their second dose, and then you have to have 70% of no health unit with less than 70% of their eligible population vaccinated. That's the conditions. And then they said, upon meeting these thresholds, the vast majority of public health and workplace safety measures, including capacity limits for indoor, outdoor settings, limits for social gatherings, will be lifted. Although mandatory face masks have been lifted in Alberta and BC, there is not an end in sight for them here in Ontario. That is if Dr. Moore and Premier Ford have their say. That's because, according to the Premier's office, Ontario's epidemiological situation is different than the rest of the provinces. It's different here in Ontario, just like the science is different. Apparently, the entire situation is different, meriting a completely different response. I digress. That's because, according to the Premier, they said, quote, Ontario's epidemiological situation is distinct from other jurisdictions because the, quote, Delta variant is the dominant strain in Ontario. Ooh, the Delta variant. Ooh, the big scary Delta variant. All right. Because of this, the advice of Dr. Moore is that face coverings should continue to be used in indoor settings until these new goals for vaccination are met. Now, I'm mocking the Delta variant. I literally wrote an opinion article, if you haven't seen it, said I'm cheerleading the Delta variant on. Here's why. It's less lethal. So we're going to go into that article now on the stupidity of the Ontario lockdowns. That's right. That is right. Sorry if everyone, I see in the comments trying to get as many on as I can. We're back to it. Where is it? Mask mandate stay for other viruses. Is that the one we're looking for? Nope. Where's my Delta? I missed. There it is. Sorry, everyone. I thought I had it really well organized for the show, and I'm realizing I still got work to do. So, video. Why I'm cheerleading the Delta variant. Perfect. So, this is our opinion article. If you haven't checked it out, check it out, share it, because this is going to become one of those things. If it's not going to be the Delta variant, it's going to be another variant. But here's what we know about the Delta variant from the UK. So this isn't my opinion. Rarely do I give you just my opinion based off of nothing. I would never do that, actually. It's always going to come from somewhere. So in this case, it's coming from Public Health England. It is an executive agency of the Department of Health and Social Care that provides the UK government, Parliament, and National Health Services, among others, with evidence-based professional scientific expertise and support. The agency released a paper on June 18th that showed that the Delta variant was much less lethal than the Alpha variant, contrary to what the academic COVID doomers have been telling the public here in Ontario. Okay, so I want to preface this with saying, obviously we got a lot of doomers here. I call them academic doomers. They're your TV doctors and your politicians and medical health professionals that are going along with the plan, no questions asked. And they seem to conveniently always seem to not notice all the studies that contradict their opinion. And they get so arrogant to the point that when things like sick kids comes out and puts a report and says we should get kids back in school, they actually attack them. I think we know who we're kind of referring to. The people that are advising the Premier and his team to make these decisions. But at the end of the day, the responsibility still is shouldered by the Premier to make the right decisions. Okay. Why we get back into this? Delta variant. Why should we want the Delta variant here in Ontario? Why should we want that? If it's the dominant strain, yes, it is more transmissible. I'm not sure at the exact amount, but I can tell you what we have from the data. Here it is out of the, I can pull it up. It's for the people that don't trust me, but this is right from a government report, Public Health England. You can find it in there as well. But here it is in the article. Alpha variant, 224,000 cases, case fatality, 1.9%. Okay. Delta variant, oh, it's big and scary, and then we need to keep the mask mandate extra long and get vaccination rates up even higher because it's big and scary, everyone. 60,655 cases. Decent. I would say that's a very decent sample size. I think we could agree on that. 0.1% case fatality rate. I even go a little bit further. So I just say I want to drive this point home for people. That means in the UK, where the Alpha variant represented 224,000 cases in the data, with a case fatality rate of 1.9%, if they had the Delta variant instead, there would have been 4,256 lives saved. Okay, let me repeat that. If they had not gotten the Alpha variant, based on the data that the UK Public Health England has presented, 4,256 more people would have lived based on the just raw statistics, no outliers, just based on the data in front of me. 1.9% case fatality rate versus 0.1. The variance. Why are we in this mess in Ontario? That is a good question. The Delta Plus is next. Delta Plus, it's coming to get you. Right. Continuing on. So a little bit about Ontario lockdown stupidity. So they're going to go Delta variant. It's scary. We need to be scared about that. But as you can see, case fatality rate on that way down. Continuing on. Oh, it gets worse. It gets worse. I don't know if anybody's heard about this one, but this is our Dr. Moore, the Chief Medical Officer of Ontario, talking about, he's already prefacing it. Maybe we get rid of the mask mandate for COVID, but you know what? We're concerned about another virus now. And he's already said that, and the media's kind of forgotten about it. But here it is, just in case you've not seen it, just in case we reach the new goalpost of our vaccination and we're supposed to lose the mask mandate. Just remember that Dr. Moore, the Chief Medical Officer of Ontario, has already said this on the record. So MPP Roman Baber released a short clip of CTV News with Chief Medical Officer Dr. Kieran Moore. In the interview, Dr. Kieran Moore said that there is a virus called RSV respiratory syncytial virus. As people stop wearing masks and socially get together, that virus is actually spreading very rapidly in the southern United States, causing children who didn't get exposed to it during the winter to get that virus in the chest, and it will mimic COVID. I don't mean to drive home the voices, but I mean this is what they're doing. So I'm trying to drive home the emotion of what they're doing with their language. So obviously that doesn't provide relief. But what is RSV? This is, again, we can't take them at their word anymore. I'm sorry. They've lost that privilege. They don't get to be taken at their word anymore. Okay, oh, RSV is scary. I should be scared. Oh, they're telling me it's scary. Okay, what is RSV according to the CDC? Here we are, Center for Disease Control and Prevention. What is it? Respiratory syncytial virus, or RSV, is a common respiratory virus that usually causes mild cold-like symptoms. Most people recover in a week or two. It can be serious, especially for infants and older adults. RSV is the most common cause of bronchiolitis, inflammation of the small air lungs and the lung. Now, they are going to say this is an issue, and now this is the new issue. And they are literally causing more of the problem that they've already caused. What do I mean? On the masking, they're continuing to put people in the virus, or sorry, common respiratory virus that causes mild cold-like symptoms. Where is the document I have on this? Here it is. I lost my train of thought. New Zealand, what do I say? They're making the problem worse. They're literally saying we need to continue doing the thing that's made the problem worse to help, because they're like telling you the solution's the thing that made the problem. And what do I mean by that? Out of New Zealand now, this is theguardian.com. New Zealand children falling ill in high numbers due to COVID immunity debt. What does that mean? Doctors say children haven't been exposed to a range of bugs due to lockdowns. Distancing and sanitizer, and their immune systems are suffering. My goodness. I don't know who's been following us for a while here, but I was calling this a way long time ago. We were saying, what are you doing? You're going to hurt people's immune systems. The thing you're saying you're trying to protect people from is what you're going to hurt them with, because you're locking them down, you're masking them up, telling them they got to sanitize everything so there's no exchange of germs. And surprise, surprise, now we're seeing evidence of the harms coming out of New Zealand. Wellington has 46 children currently hospitalized for respiratory illnesses, including what? Respiratory syncytial virus, or RSV. Same virus. A number are infants and many are on oxygen. Other hospitals are also experiencing a rise in cases that are straining their resources, with some delaying surgeries or converting playrooms into clinical space. RSV is a common respiratory illness in adults. It generally only produces very mild symptoms, but it can make young children extremely ill or even be fatal. The size and seriousness of New Zealand's outbreak is likely being fed by what some pediatric doctors have called an immunity debt, where people don't develop immunity to other viruses suppressed by COVID lockdowns, causing cases to explode down the line. Epidemiologist and public health professor Michael Baker used the metaphors of forest brush fires. If a year or two have passed without fire, there is more fuel on the ground to feed the flames. When a fire finally comes, it burns much more fiercely. What we're seeing now is that we've accumulated a whole lot of susceptible children that have missed out on exposure, so now they're seeing it for the first time. You wonder why I sound so frustrated? Because we got TV doctors still advocating for lockdowns and restrictions and masking and all these things that are preventing the transmission of everyday viruses that are leading to these problems. Cost benefit analysis. Public health is more than COVID. It has always been more than COVID. Cost benefit analysis. Big picture. What's the economic effects? What's the effects on mental health? What's the effects on overdoses? They've ignored it. They don't care. And now we're going to come up to an election here, and they're going to talk and offer all these goodies again. And oh, I heard Alberta's offering money into long-term care. We'll get into Ontario later, talking about putting money into long-term care investment, coincidentally right before an election. Coincidentally, they waited all this time. They could have invested right off the hop. I think they knew they could have invested 16 months ago, 14 months ago, a year ago. They could have decided to invest this money, but no. You think it's coincidental that they wait till just before they think an election's going to be called and suddenly the money starts getting doled out like that? My goodness gracious, wake up, Canada. These people do not care about you. They care about them. It is me politics. And me politics means I convince you that I care, but I don't care. All I have to do is convince you that I do. They have proven time and time again, their track record says they don't care about you. I have a documentary, for those who are not familiar, I'm working on it, Lockdown Canada. I have Christine Elliott. She was asked early on by a sharp reporter, I think from the Globe and Mail actually, who asked, one of the doctors we're talking to is saying, lots of, respirators are great. That's great. But we don't even have the staff to staff the ICUs. This is the real issue. And so what's your plan? It's great to invest in ventilators, but what's your plan to invest in staff? And she's on the record. I have it recorded for the documentary. That's not our priority right now. It's not their priority to hire staff right now. But then, okay, let's do the clap thing because everybody, whatever that thing. Then 16 months later, all of a sudden they got $4.9 billion for long-term care investment. But that question that I have documented, Christine, you said it wasn't a priority. Were you just waiting? Because you thought that, well, we don't want to help people now. Let's hurt people by not helping them now and wait for the election. Was that what happened? I'm just saying, it's coincidental. It's kind of weird. I'm a little fired up today. No. Woo! Yes, it will start over with Fear in the Fall. That's honestly what I fear. I just believe it's going to be a recycled case of the same but different, right? Different variants, slightly different narrative, whatever they think. Whatever. Back to lockdown stupidity in Ontario. I just want to show this one. Alberta. Mask use in public indoors is no longer required except for some specific situations, working in or visiting continuing care facilities, and then public transit. That's it. Lifted. Back to normal. But here in Ontario, here's what we get to open up to. This is what's up. Outdoor social gatherings and organized public events, 100 people with limited exceptions. Indoor social gatherings and organized public events, limited to 25 people. Indoor religious services, rites, ceremonies, including wedding services, funeral services, permitted with physical distancing. Indoor dining with no limits on the number of patrons per table with physical distancing and other restrictions still in effect. And keep in mind, the mask mandate is still in effect here. So, this bothers me, especially when it comes to church. I'll talk about the mask mandate in church especially. But indoor sports and recreational fitness facilities, 50% capacity of indoor use. Capacity for indoor spectators, 50% of that of usual seating, with a capacity of 1,000 people, whichever is less. Capacity outdoors is 75%, because apparently outdoors we need to limit capacity to, with a limit of 15,000 or whatever is less. Indoor meetings, permitted to operate with physical distancing, other restrictions, capacity not to exceed 50% capacity. Essential, non-essential retail with capacity limited to the number that can maintain a physical distance of 2 meters. Personal care services, including those requiring removal of face masks with capacity limited to the number of people that can maintain a physical distance of 2 meters. Again, lots of rules and regulations. This is kind of how it's shaken out. And when it comes to church, I want to drive this home. It puts you in a different frame of mind. You're going to sing in church with a mask on. I don't want to sing with a mask on. That's gross, first off. Secondly, it impedes my voice. And third, it kind of affects my psyche and where my mind's at, just having this on my face, because I am not fully focused on what I'm supposed to be, which is the church service and the spirituality and connecting with God. That's what church is supposed to be about. So thinking about this, you're going to mandate the mask still. The churches can get back in, but you still can't see people's faces. The church is people more than anything, not a building. Still can't see people's faces. Can't take that off and connect. It bothers me. And you can't really sing properly. And here we are. And we don't know. We're looking at like probably end of August where we may have a chance to lose the mask mandate, and we'll see if they shift the post again. But I completely understand. Lockstep all over the world. Well, no one is listening to any of this since they got rid of our mask in Alberta. Even the stores that say they require it, people just walk in. Well, that's what happens. I mean, it gets to, if it's, I honestly think you lose the mandate on the mask, we'd probably still see 1/3 of people. In certain areas, it'd be higher. I bet you in Toronto, you see so many people outside on the sidewalks. The amount of times I've been up there covering different things, the amount of people on sidewalks walking outside with a mask on all the time, driving with their mask on, I wouldn't be surprised if like half of Toronto just keeps wearing it. Continuing on. All right, we're gonna move on from Ontario lockdowns. Oh wait, no, we're not. We got one more thing for you. Okay. Let's Justice Center put this out in November of 2020, and this is called 20. Okay, sorry everyone. It's called Flying Blind: Government's Hasty Decisions to Lock Down Canadians While Damaging Public Health and the Economy. Now, I wanted to bring this up because there you go. They have some interesting data in here, and it's old data, so it should be surprisingly shocking. November 2020. Hospital bed capacity as per Canadian Institute for Health Information. Hospitals beds staffed in operation 2018-2019. CIHI. It should also be recognized. Okay, sorry. Here we are. It became very clearly early on the healthcare system would not be overwhelmed by COVID-19 patients, nor is the healthcare system in danger of being overwhelmed today. Nonetheless, politicians and health officials continued to call for flattening the curve and continued to impose charter-violating lockdown measures in April and May in order to preserve healthcare capacity, and now are reimposing such measures. Moreover, politicians appear to be relying on the assumption that despite higher than levels ever of spending on government healthcare monopolies, it is somehow impossible for the healthcare system to increase the number of beds and ICU spaces. Good point. Charter violating lockdown measures are necessary because governments are spending every healthcare dollar wisely and efficiently. Given the available data from both Canadian sources and other countries with comparable health systems, Canadian public health officers should have known that the provincial healthcares would likely not be overwhelmed by COVID-19. By the end of April, Canadian governments had sufficient data to know that COVID-19 posed insignificant risk to the vast majority of their citizens, and the country's healthcare systems were highly unlikely to be overwhelmed. By the end of May, it was even more clear that this was the case. Healthcare systems had not been and would not be overwhelmed with COVID-19 patients. 6 months later in November, this still remains the case, as demonstrated by publicly available data on hospitalization rates, hospital bed capacity, demographics, and the non-existence of a second wave of COVID-19 deaths. So Flying Blind, JCCF, they have that document. That was in November of 2020, 6 months into this, and they just laid waste to the government's approach. And here we are. I mean, how long can we keep going where it's like somehow Ontario's different? I did an article a while back. If you haven't checked it out, I did a case fatality rate comparison between Nevada, Florida, and Texas and Ontario. Now, I believe Florida opened in September of 2020, no restrictions, dropped it all. I could be wrong. Don't quote me on that. And they have a lower case fatality rate than Ontario when I wrote that article. I don't know if that's the case today, but it was 0.1% lower. No restrictions, September of 2020. Do our medical professionals here just get to ignore these very inconvenient facts? Because it seems like they do. And the whole system is set up that they never get challenged. They're vetting the journalists that get to even show up at pressers from even the approved sources of media, just so you know. Only approved journalists from the approved sources get to go anymore. And so we're going to expect that we're going to get the truth. Looking through the comments here. Yep, nailed it. None of the temporary hospitals got even one patient were taken off eventually. Imagine the amount of dollars spent on them. Well, let's take that a step further. Imagine the amount of dollars. Well, we know that a certain SNC lab one got 150 plus million, I believe it was, to build field hospitals. Oh, how many doctors, nurses, PSWs could that hire? How many years? And for what? Political photo op, kind of the show. It's big and scary that you know, or was it a show of force? Oh, we're helping, but we're not. It's not a priority right now, as Christine Elliott said, to invest in staff. But we'll invest in a field hospital, and we still continue believing the nonsense that these people feed us. James Thomas, testing is all fraudulent. So let's pull it up. JCCF. Nope. So JCCF, the Justice Center, in court had the Manitoba chief microbiologist and laboratory specialist under oath admitted that 56% of the PCR positives are false positives, meaning they're not actually infectious with anything. Quote, the Westphalian Times explains PCR test as follows. We're not concerned with it. Dr. Ballard testified that the most accurate way to determine whether someone is actually infectious with COVID is to attempt to grow a cell culture in the lab from a patient's sample. If a cell culture will not grow the virus in the lab, a patient is likely not infectious. A study from Dr. Ballard and his colleagues found that only 44% of positive PCR test results would actually grow in the lab. 56% false positives. Cycle threshold, you get above 25, have a hard time cycling them. I don't believe I believe I've had, again, it's hard to stay up on all this, but I believe I did an article where they're still tracking this, and the cycles, I think over 25, they couldn't actually get it to grow our culture in the lab, meaning it wasn't actually infectious over 25. But again, this information is so hard to keep up on because it's fast and furious when it comes to that information. Any news about food shortages? Apparently that's coming. Well, good questions. There's lots going on behind the scenes. If you don't know with what's going on with a lot of the farmers, basically the COVID policies really hurt a lot of the farmers here in Canada. They couldn't get their foreign temporary workers in. They had to quarantine them and put them behind. And there's some major concerns. I believe what farmers organization it was put out said if they can't resolve the work issues, the labor issues, there was going to be shortages of fresh fruit and veggies in Canada, or in Ontario at least. So I mean, yes, there's some serious issues. I'm looking into also, I guess Mexican meat has been finding its way into Canadian grocery stores. It's not even a new issue. I thought it was. And I looked, and I actually found an article from 2014 where this was occurring. So yeah, so there's all sorts of stuff in the food chain that really needs to be monitored right now. I did an interview with Kelly Verbeek, can't remember, Verbeek Farms, but they're going through it, and they talk about some of the challenges they face through some of what's happened with COVID. And with them, they're tomato farmers, and they haven't had the restaurants need what they normally need, and so they had massive amounts of tomatoes that were just going to spoil, and we went up and covered it. They just put out a social media blast and said we're going to sell them at $5 a flat, just rather than lose money outright. And the amount of support they got was tremendous, because it was lined up around, like, down the road, and hundreds and hundreds and hundreds of people there to get tomatoes, and they're still doing that. But yeah, there you go, Craig. Craig nailed it. Yes, ungraded meat from Mexico. So that's kind of the news story that's coming out. I'm going to keep an eye on it. But again, I've seen some articles going back from 2014, it looks like, on the ungraded meat from Mexico issue. So it's apparently not a new issue, but it's coming to the forefront of Canadians' minds now. Fauci admitted last July in Virology Today podcast, 30 plus cycles likely, 80% false positive. Yeah, I believe I quoted him talking about that. It was a phone call with a public health person. They admitted to me on the phone that Ontario does 38 to 40 cycles, I think. And I mentioned that Fauci said anything over 35 is picking up dead nucleotides, and he kind of panicked. But yeah, that's been out for a while. Has anyone been keeping an eye on the cyber attack exercise done by the same groups who did the Event 201 exercise? So yeah, that's coming up, or is it already started? That's the World Economic Forum. That's putting together a cyber attack exercise, I thought it was. Prices are high, and yes, food is starting to run out, and what is left is the expensive food. Prices are high, and inflation is a big part to blame, paying people to stay at home with money you don't have, and just flooding the supply of money just out of nowhere. That's what's going to happen, and this is why you're seeing inflation explode. And then I literally seen a media source to put out, but like, silver lining, everyone, you'll probably have higher wages because of inflation. High five. So, oh man, brutal. All right, we got to get on here. Ontario lockdown stupidity. Moving on to Trudeau getting heckled. Here we are, video. You got it? Let's do the video. We'll just play the video.
Incident response group meeting is going to be on this afternoon. How we can be there to help, and we will continue to be there.
Everybody out!
Nous allons être là pour aider en Colombie-Britannique et à travers le pays. Nous allons être partenaires au gouvernement provincial. On a parlé avec le premier ministre Horgan, on a parlé avec les ministres impliqués. Nous allons continuer d'être là pour aider à Lytton et partout à travers la Colombie-Britannique et l'Ouest canadien. C'est pour ça qu'on va se rencontrer en tant que...
So, Trudeau's giving a speech, and he's got a guy heckling at him from the background. Every Canadian suffering, Justin. You're a traitor to Canadians. He said, that's not fair. You're just thinking of yourself. What else? He said, Canadians still don't know. Oh, that's Trudeau. All right. And then, yeah, so there's Trudeau getting heckled. And I'm sure it won't be the last time as we come into an election here. I'm sure those type of chirps are just getting started, which is why I'm sure that the security will be pretty heavy as well. People need to get out there and support the small shops. I agree. I had a conversation with somebody, though. It's easier once the restrictions are lifted. But when it's hard to get out, especially like somebody like me with a family. Sometimes it's easier to go to the big box places than go out of your way to the smaller places where you got to go to multiple places. But yeah, they really need it. These businesses are struggling. They're not getting the help they need from their advocacy groups that are, I mean, like, let's be real here. Like, in my opinion, the CFIB, much, much, much too late to raise your voice, and you got to stop being so wishy-washy. Like, oh, we wish the government would do more. No, you're you're tanking businesses. Keep going at them. They need to open, full stop. And even now, a lot of these businesses are going to open up, but it's like half capacity, and they're taking on massive amounts of debt just to be able to play this game the government wanted them to play, and then they still find out they can't even operate at full capacity. It's like somebody telling you your earning potential is going to be cut in half potentially, and you don't know when that will end, and people think that's okay. Yeah, you might think it's okay if you don't have a business. That's the issue. So, if you're receiving a paycheck, it's a lot easier to preach. And moving on, long-term care investment in Ontario. We're going to close out here. Where are we at? $4.9 billion, like I said, over 4 years to hire 27,000 long-term care staff. So I'm going to release, there will be a trailer coming out shortly of my documentary where I have Christine Elliott talking about that's not their priority right now to invest in healthcare staff. Only to decide, I guess, 10 or 12 months later that it was their priority to invest in long-term care staff right before an election. It is what it is, but here we are. 4.9 billion. So here's what he says. They're going to be announced. They announced 4.9 billion over 4 years, and they said it's to hire 27,000 more staff for long-term care, and that would include registered nurses, personal support workers, and support staff. So I find it concerning when they use the word including, because I'm wondering how much is going to be going into overhead expenses. One thing is certain. Problems in long-term care have been highlighted during COVID-19, and the cracks in long-term care system have become very apparent to voters. So Rod Phillips, Minister of Long-Term Care comes out. This government is repairing and rebuilding Ontario's long-term care sector after decades of neglect. Yep. We're going to throw the other government under the table after we waited all this time to make the announcement. And Christine Elliott said it wasn't her priority to invest in healthcare early on when they were asked about ventilators. And it just drives me nuts. Minister Phillips told reporters, Ontario now has 20,161 new and 15,918 upgraded spaces in the process of being developed for long-term care, according to the government of Ontario. As of February 2021, more than 40,000 people were on the wait list to access a long-term care bed in Ontario. So I just find the timing of this in general suspect and have a hard time kind of trusting the Ford government on that. But again, the end of this week, I'll have the trailer out for my documentary and you'll be able to see exactly what I'm talking about. Christine Elliott talking about that not being a priority. It just drives me nuts. And then all of a sudden, right before they think an election is going to be called, now we're going to announce the investment in the long-term care. Greasy politics, in my opinion. But that's just my take. Well, all right. What do we got for the comments here? Let's get back. Oh, none of the temporary. We got there. That's where we left off. I would agree that unelected health officials shouldn't have this much power on our system. They should be there they should have, they should be a part of the conversation and giving advice. But to have the power that they do where they can literally overrule and then make up their own rules in an area, I think it's Section 22 they can call as a public or medical health officer of an area, and then they can overrule the premier, like as long as we're under Emergency Act. And I know a lot of people think the emergency use authorization was pulled. My understanding of things is it's been re-rolled into the Reopening Ontario Act. And so it's kind of under that, and it's just subheaded forward. I don't know enough about the legalese to tell you much more than that. So I have to apologize on that if you're looking for more information. Only meat I buy is local, butcher shop, and all local grown beef pork. If you can, it's a great way to go. If you find something that's affordable, the real key is like buying in bulk. If you can, buy $300 to $500 at a time and get it discounted. If you have a deep freeze, do that. And then, depending on how big the deep freezer is, you might need to get vacuum sealers and all that fun stuff. I could tell you, I grew up in the country. We jarred. We know all about this kind of stuff. And when you live a long way from the grocery store, you typically don't like to go back consistently. So you buy large amounts up front, and then you learn things, tricks of the trade. You can get discounts. Anyways, it's country boy in me. Continuing on, we're going to end it out here. I think we have everything I wanted to show you except one thing, and that is the CPSO, College of Physicians. What is it? College Physicians. Anyways, the oversight committee for our physicians here in Ontario they're readdressing something. Their social media general consultation. I'll just read it. CPSO's social media appropriate use by physician statement is currently being reviewed. A new draft social media policy has been developed to replace the statement and set out professional expectations for physicians using social media. Now, I'll explain what I didn't like, what I've seen in this. I haven't read in all of it, but when you use language like must, that implies that if you don't, there will be consequences, which means there's a threat attached to that must. What that is, I don't know. But here's what it says. Physicians must conduct themselves in a respectful and professional manner while using social media. Okay, we can agree. Yes. Physicians must consider the potential impact of their conduct on their own reputation. This is where it got weird. The reputation of the profession and the public trust. Okay, whose opinion now? Okay, the potential impact on the public trust. So if you believe it's impacting the public trust, but it's potentially information that's valid, are they going to face consequences as a result of giving us that information now? It's kind of some of this ambiguous language. So this is something to keep an eye on. I'll be looking through more. But again, you have the CPSO. They're reviewing currently a new draft social media policy. You can view the draft policy yourself. You can view the advice document or complete the online survey. They're currently taking feedback on this new social media draft policy. And so get your say out. This is fundamentally the biggest issue on the right, in my opinion, is everybody likes to talk, nobody likes to get involved, and you need to get involved. And it's more so than just writing somebody, things like that. Like, get involved in your school boards and things like that. If we're concerned about the education system, then get your voice inside the education system. That's how I feel about it. That's just my take. You can't have a voice if you're not at the table. And so, yes, a lot of these things aren't, the cup of tea of everyone here. But if you care about things and the values and the morals that you believe need to be put forward into the world, then you need to make sure they're represented in the world. And it's basically as simple as that. What's crazier, Paul, is they aren't subject to Freedom of Information Act on science table because they aren't part of the government, despite their influence on policy. Exactly. So if you don't fall under like a federal or provincial office or office of the government, you can't access the information requests. So even though they're giving all this advice and these reports and these models to the government to advise their decision making, you can't ask. Crazy. Appreciate it, James. Kate Wanna's been covering this too. She does great work. If anybody, by the way, if you got an in with her, and I'll reach out to her, but I think she would be a very interesting guest to have on. So Kate, if you're hearing this, I think you do very interesting work, very good deep dives on things, and I think it would be interesting. Message us, and we could talk about some subjects we could deep dive into. I think it'd be a fun episode to do for people. Appreciate that, James. So now even Saskatchewan has removed all its remaining pandemic restrictions, including masks. That's right. Anthony Fury just posted that on Twitter. Yep. And so Alberta, BC, Saskatchewan, and then there's Ontario. And so I almost wonder, we'll close off here. We got the Ontario newsroom. COVID-19 data, Ontario. Close off with, I guess, just the most recent data. I guess I'm a little ahead of schedule. I'm surprising myself. Sorry, everyone. Oh, what's the current data say? This is COVID-19 data, Ontario. All Ontario case numbers and spread. What do we got? Total 547,000 cases so far. Resolved 536,000. This is just Ontario. The effective reproduction rate down to 0.85. Where's my hospitalizations? Continuing on. ICU on a ventilator, 107. In ICU, testing positive, 155. See, this isn't actually, you want to talk about examples of deceptive data manipulation. I mean, if you're looking for just this, you just see in ICU due to COVID-19. And if you're just looking, 202 testing positive, 155. So it's 155. They might have tested positive beginning going into ICU, but that doesn't even mean that that's the thing that put them there, especially when we consider that chief microbiologists in Manitoba, under oath, admitted that in the lab, 56% of their PCR tests weren't actually infectious. So put this in perspective. If that's 56%, then let's go 155 divide by 2, right? 56%, that's the number. So cut that in half. Testing positive on ICU, cut that in half. Because at least half of them probably didn't have something infectious, meaning it wasn't COVID that put them there, at least. That's hospitalizations. What do we got? Long-term care, testing results, volumes and results. I wonder how much that's dropped in recent days. Where are we at? Past 30 days? They're running about 19, 20,000 tests a day. Where were we at 90 days ago? You can just see how much it's gone down. April, we were at 65,000 tests a day. Got into May, 47,000. It's just been a gradually down decrease. And now we're at the point where we're 19,000. Okay, there's one more thing. KPL. Nah. I'm not going to be able to find it. Not under pressure. It's too much pressure. There's a hospital tab I have, but I'm not going to be able to find it. Bookmarks, maybe. KP. Maybe Paul can tell me. Paul, if you're still in here, what's the ICU beds, hospitalizations? What's the website for that? I have it bookmarked somewhere. It's just really, really deeply gone down there. The people. All right. Yes. No more masks in Saskatchewan as of today. Done. Finite. Finished. Same with Alberta. Same with BC. And we're still dealing with it here in Ontario. But yep, that's where we're at. Paul, send it. I want to show people that it has the breakdown of all the ICU hospitalizations and where the beds are at. Surge capacity of hospital. Surge capacity. KP. I always forget the name of it. There's no way I'm finding it. I want to show one more thing here. Wuhan, 10 million asymptomatic study. Okay, here we go. Sorry about that. Yeah, I'm not gonna be able to find it. Not under pressure here, but I got one more thing I'm gonna show. I'm like 4 minutes ahead of schedule, and then we'll close out here. I bet Nova Scotia will just keep on having the mask. Yeah, a smaller community, older community, and I'm not surprised by that. Pulling this up, this was a study out of Wuhan, China, and we'll close with this on the asymptomatic thing, because this is the whole premise of keeping us locked down and masked up and socially distant. You don't know it, but you're passing it to grandma and you're gonna kill her. Anyways, it's a very small percentage of asymptomatic people that actually spread anything. And so when we get into the results, okay, here we go. A total, there were 34,000. Okay, so 10 million tested. Of those, are not 10 million, 9,865,404 participants. In Wuhan, they identified 300 asymptomatic positive cases. Then they take those to a lab. Of those 300 asymptomatic positive cases, virus cultures were negative for all asymptomatic positive and repositive cases, indicating no viable virus and positive cases detected in the study. Again, asymptomatic spread grotesquely overstated. Now, their explanation as to why this happened in Wuhan, I've seen the counter arguments, was basically my understanding. Oh, because it had ripped through Wuhan, you can't trust those numbers because they're different there. I don't get it. At the end of the day, they tested positive because they said they had it, and none of them actually had anything infectious. So that tells me about the limits of the testing, which is why I bring that study up. If you haven't seen it, that's in Nature. Again, post-lockdown SARS-CoV-2 nucleic acid screening in nearly 10 million residents of Wuhan, China. This came out in 2020. I've been referring to it for quite a while. And again, I'll just say it hypothetically. How do our medical professionals and politicians continue just to get to ignore studies and information like that? But thank you, everybody, for joining us. And I will catch you next time on the Sunday Show. I'm Greg Staley. We'll see you next time. Thank you.